Can you give me a sense, what is it like in Lebanon right now?
Loaded question. So currently, tensions are extremely high. People are frustrated, people are angry, people are miserable, and they're living in probably some of the worst conditions they've ever lived in. And that's not just talking about the displaced communities in Lebanon, which are Palestinian refugees, Syrians. It's talking largely about the Lebanese communities as well. Obviously, for the longest time, there have been vulnerable Lebanese communities around the country, but now a huge part of the population is suffering as a result of the economic and political situation, the after effects of the coronavirus, and obviously after what's happened with the explosion on Tuesday, which has reignited and if not added more fuel to the fire for people to really rally in the streets and pull down for a stronger revolution or uprising.
Dr. Firas, you work in the Lebanon Valley as well. You've worked with Syrian refugees. You've got these explosions in Beirut, also compromised by the fact of COVID running throughout the country as well, globally. What are you seeing when you treat these patients in the Bekaa Valley?
Sorry, the last sentence.
Tell me what you're seeing in the Bekaa Valley with the patients that you're treating.
We used to treat like the patient here in the refugee camp. There is a lot of camps here in Bekaa. We used to provide primary health care to them, and like some emergency, and we had a referral system to the hospitals and to another NGOs to help them. But after this explosion happened, all these communities, like, they asked us to help, to go to Beirut and help us, and some of them they need to donate like blankets, they need to donate blood, they need to donate anything they are able to do. Some of them they said they can go and work for free there with them, helping in the houses and building the houses.
What do you feel Lebanon needs the most right now?
In Lebanon?
As a country,
like the economic like destroyed. So when the economic destroyed, everything like destroyed, and everything else, like they need a lot of things. Especially now, they don't feel they are safe in their country, and also we don't feel that like not like before. For example, the last year it was better. The last month better than this month, and I think like in the future will worse more than now.
You say that in the future it'll be even worse. They're dealing with the explosions in Beirut, the political unrest, civil unrest. You also have nearly 1.5 million refugees from Syria. How does the refugee situation exacerbate all of the tensions that you're seeing right now within the country of Lebanon?
I don't know how I will explain in English, but I'll try. Now they didn't have like now the Syrian refugee, he will be agree to work in $1, $2 per day. The Lebanese cannot live like this because the Syrian refugee is living in a tent, so is able to take like less money, and the companies, of course, they will take the cheaper price or the cheaper worker because they want to offer. So this will affect the Lebanese because the Syrian like take their places in many companies or industries, and the other thing like the traffic or in the houses or in the, they don't have that I don't know in Arabic, but the cities, like they don't organize the cities, and
there's no efficiency in like the infrastructure of the country.
Exactly.
And they try to build that in Beirut, for example. It's completely different where it was prior to Tuesday, how the city was rebuilt after the war, after the civil war. But ever since then, it seems to be chaos in so many areas of the country, and the political situation obviously doesn't support that, because each political sector supports a group of individuals or a population group within the country,
areas, yeah.
or areas, regions within Lebanon. So that's what I meant when I said that the country is fractured, the infrastructure is fractured, and the lack of efficiency is quite detrimental to the Lebanese living in kind of cohesive society. Elaborating on what Dr. Firas said about the Syrians, so they're willing to work hard, they're willing to do what needs to be done to support their families and provide, because A, they don't really have anywhere else to go, and B, they don't really have any other choice. Generally the Lebanese population won't do some of the jobs that the lower paid workers will, but now they may not have a choice. So that is something that may come to change over the coming months, possibly years.
What do you
see? For example, you see that there are everywhere in the streets, and they put us like a reason, because the Syrian refugees here, you see the rubbish, because we are not able to remove all this amount. For example, this is like small example from what they say about us, or what we
how they represent it in the
exactly.
country.
When you talk to the people in Lebanon, what do they say they need the most?
The Lebanese, the Syrians, Palestinians, or generally the population?
Everybody that you're speaking to.
Everybody. They want stability. They want stability in the country. They want governmental, economic reforms. And in a way, that was one of the biggest things that the revolution, or the uprising in October 2018 showed, that 2019, I think, that people will all come together regardless of sect, regardless of religion, regardless of political affiliation. And even at the time when people were rallying in the streets in Tripoli, in Beirut, in the south, Syrians and Palestinians and other groups were actually joining them, not in the masses for security reasons, but they were still out there in solidarity with the Lebanese. It was quite interesting to see that for the first time, in the longest time, everyone is calling out for the same thing, for the government to really change, and therefore for there to be a mass overhaul. Because if it maintains in the same way, it's going to have an even bigger impact on livelihood of not just the displaced people that are already suffering, but the Lebanese in general. And I think they're really feeling that right now.
What's the spirit, especially in Beirut? You have, as we mentioned, refugees. What are people doing right now to pick up the country?
Interesting. Yesterday, the last few days when we've been on ground, it was quite, for me anyway, and you can elaborate yourself, but it was quite overwhelming to see how many people came out to just volunteer and to support. There were hundreds of people with their masks on, with brooms, with backpacks, going out to help clean the streets, to help clean up buildings, to help remove the glass. Hundreds of people coming to the Martyr Square, where there were aid and relief efforts going on, bringing food, bringing water, bringing supplies. In our clinic that we were running, we had people come up to us and say, "Oh, what do you need? What kind of supplies are you running out of? What would you like? Give us a list, we'll try and get." And some people would come with boxes, some people would come with a small carrier bag from the pharmacy. It was quite incredible. It's how would you say, it's reassuring to know that people are still trying to live as a community, but at the same time, I personally feel that people are not considered, they're not feeling appreciated, they're not feeling respected, and they're not feeling looked after by those who are supposed to protect them, their government, the people they look up to. And so they're looking out for one another, but one another can only do so much, unfortunately.
It's remarkable to see in times like these how people help each other. But you look at the economic reality on the ground, inflation rising at incredible levels. How does this affect something like the refugee situation, and especially with COVID, countries spending more money to combat COVID, does that affect the funding that you get for people in need?
This affects everything in Lebanon, especially the refugee. They were working, for example, most of them like are farms for $3, which it was like about 7,000 Lebanese lira. It was like about $4 and a half, but now it's $1. And if you want to go and buy anything in 7,000 now, is you can like just get by $1 the same now. So it affected them a lot, and nobody care about COVID, and nobody can do anything for COVID. They are not able to get masks or alcohol, or they are not able to stay in their tent, which is like one room or two rooms under the sun the whole day and isolate their self. It's difficult for them. So I think like nobody care about COVID, and they are really affected like by the economic state, and they are helping each other. This is the beautiful about them. They can share their food, they share their blankets, they share everything that they get, especially in one camp, or when they see like there is family they go all and try to donate and try to bring anything for them and helping them. It's beautiful around them, yeah.
What do you think the people can do in this moment of crisis as inflation is rising, as desperation is growing, and they might not be getting the help that they need? I know there are a lot of countries, including the United States, who have promised to help. But what can the people on the ground do in a situation like this?
I think it's really hard to say. A lot of people feel like they've exhausted so many options. They will continue working. The people here the Lebanese especially, will continue demonstrating and will continue fighting for what they want. But there's only so much the people can do, and that's just the Lebanese. With the Syrians, the Palestinians, the displaced communities, they are very, very limited to what they can do to help their situations. I don't know how much people are aware of the rights that these communities have in Lebanon, but they are quite restricted and limited to the services. Many aren't allowed to work in most industries, and as a result of COVID, many of the labor workers were let go because of quarantine and lockdowns. Aside from these jobs, they don't have any other source of income, and unfortunately, the Syrian refugees have to pay subsidized rent for the tents that they live in. It's not covered by the government, it's not covered by UNHCR, and this was a real cause for concern at the start of the crisis, because we were hearing back from many, many families about needing rent support or fear of being evacuated by their landlords off the land that they live on. So if they don't comply by what's happening in this country, there's the threat of being arrested, detained, or being sent back to Syria, which is a real fear. So people will find a way, but it won't be as explicit as the Lebanese will, because they have rights in this country. When it comes to the Lebanese, I think they can continue supporting one another and continue to fight for what they want, in the hopes that things will change, because the change, I personally believe, has to come from the very top in this country. It's gone on for far too long, and too many people are suffering, not just the guests in the country, but their own civilians.
Can you describe a little bit about what you're seeing? The hospitals in Beirut are completely damaged. It's incredibly hard for many people to get treatment. Tell me what you're seeing on the ground.
On the ground, we had many patients in the last 4 days, and they explained to us. For example, one case came to us with like tachycardia, and she needs emergency. She need to go like to the hospital for emergency. They didn't find any place in many hospitals there in Beirut. So they brought her to us because they said they couldn't take her. They don't have any space, and they are not able, like a lot of people in the hospitals. and in the emergency rooms. So we treat her. But I think it's difficult, especially now, like with COVID. If anything happened, they will not be able to do anything for the people, I think. And the situation will be very difficult, and nobody will look after the people, the Lebanese or the Syrian or the Syrian or anyone. The hospital is small. It's private hospitals. They take money from everyone. Not all the people able to pay money. There is many people died like from the hospital because they didn't have money. So I think later the situation will be more difficult. It's not easy.
We also, we also treated many tens and tens of patients with previous wounds and injuries from the blast who came to get redressing or clean of their bandages and redressed. We also saw many new wounds. Lots of people, volunteers, who were actually going to clean glass from the streets or supporting from the building and would get injured and would come to us to just get some emergency care. Alongside that, as Dr. Firas mentioned, we were seeing primary health issues purely because people were finding it really difficult to access either primary healthcare centres or the hospitals. Not only are they at full capacity, but actually two of the main hospitals in Beirut were damaged quite heavily by the blast. And so there are fears of severe destruction or collapse of parts of the building. So they've had to cordon off and close off some of these areas, which is worrying. But on a positive note, the city were able to send many of the injured and some of the critical cases outside of Beirut to other hospitals who have opened up their doors to take people from around the country.
And the private clinic and polyclinic is closed because all the doctors went to the hospitals to work there and help there.
In terms of medical supplies, what are you seeing that you feel you need the most?
Like the country?
Not for us as we're working.
For us, like our work?
In general, as you're treating these patients, what do you feel that you need the most when it comes to medical supplies and that urgent need as these hospitals are just completely damaged?
If we need to work like this, we need everything: medication, supplement, machines. Like we need a lot of things to be able to help the people and continue like this. Because now it's difficult. We don't have many things now. If we need to sterilize the minor surgery equipment, we are not able. We are like sterilized by fire and alcohol there because we don't have autoclave or resources. We need a lot of things. Like we need everything. If we need to continue like this, it's difficult. It's not easy.
So you're going into surgeries, sterilizing without alcohol. You're using fire to sterilize your surgical equipment?
Alcohol with fire. We are sterilizing like this, yeah. And working the 4 days like this because we used to do this in Syria before, and we had this experience in Syria before. So now we are trying to use our skills, which we get from Syria here in Lebanon. But it's difficult to continue like this. It's difficult because a lot of injuries and a lot of wounds and a lot of patients and cases, and we didn't have place under the tent, under like small tent in the street from everyone in open area like.
We've pledged that we will continue to go wherever it's needed, and as a result of the demonstrations today, we think there might be some more tomorrow, so we might not be able to go to Martyrs Square, but we might have to move around somewhere else in the city. But longer term, we know that it's not a sustainable solution. We've been fortunate enough to have an overwhelming amount of support, people wanting to come and support us on the ground, you know, bringing us supplies, etc. But holistically for the country, so much more is needed. I've heard on the grapevine that they're building kind of temporary flying hospitals or centers in Beirut or around to support the hospitals that cannot take any more patients. But until now, it's not clear if that's happened as of yet, where and what they're actually going to be catering to.
As we wrap up, I want to ask both of you, what is it that you'd like the rest of the world to know about Lebanon right now?
About Lebanon, the situation in general very bad. They have good people, they have good nature. But in general, the politicians like very bad, and they are treating their people like in very bad way, and they are teaching them like very bad things. They want from the people to destroy each other, and they want to stay in their places. They don't want to do anything good for this country, this beautiful country. Uh, but in the future, the situation like really will be very bad. Like we can see, like it's clear to everyone that is going to this country to destroy. We will, they will have a very bad future. They will say like this.
Yeah, I would second that. Just to add, I've always really liked Lebanon. I came here to volunteer before I joined these guys in our clinic. But it's really worrying to see the escalation over the last couple of years. And as I said before, if things don't change, and it doesn't seem like within the country people are going to take those steps, especially within the government, political, economic system, it might need international support, but that means a real international call out for reforms within this country, not to destroy the political system, but to support the people of the country, not just the Lebanese, but everyone who's living here.
Dr. Firas and Asma, I want to thank you very much. I know it's such a difficult time and you're doing such incredible work trying to get the country and the people up and running. Thank you for your time.
Thank you.
So much.